For vulnerable patients, receiving the correct treatment quickly is crucial. The Royal Berkshire Hospital uses BioFire, a rapid diagnostic tool from bioMérieux, to test a broad range of bacteria and viruses to quickly identify the cause of infection. This improves diagnostic certainty, allows prompt and appropriate treatment, and facilitates faster discharges.
When a patient presents in the hospital, they present with a constellation of symptoms and signs of a clinical syndrome.
Rapid diagnostic tools have the capability of transforming care in the NHS. Dr. Shabnam Iyer says the 21st century requires 21st century care to improve the patient journey through the hospital.
And that clinical syndrome could be caused by a whole range of organisms, ranging from bacteria, viruses, fungi, and in some cases parasites. With the traditional methods that we have been using for past so many decades, they are limited in its capability of diagnosing infections with all this range of pathogens.
What value do these rapid diagnostic tools have for the NHS?
These multiplex PCRs have enabled us to identify now the current epidemiology of these infections and the range of pathogens that can cause a clinical syndrome, which we had previously labeled only with the limited number of pathogens that we could easily identify using the traditional methods.
Good communication between healthcare innovators, clinicians and the lab is key to the success of bioMérieux's BioFire tests and how effectively it's used by healthcare professionals. But the real benefits lie in syndromic testing for conditions such as pneumonia, septic arthritis and sepsis, as is seen here at the Royal Berkshire Hospital. The testing has now become an integral part of treatment for the hospital's most vulnerable patients.
We want to know what the bacteria is that's causing that particular infection, and that increased diagnostic certainty allows us to ensure that our treatment plan or treatment algorithm is again tailored towards that patient. Hello Michael.
Good morning.
How are you doing?
The challenge is to integrate and implement cutting-edge technology that is cost-effective, fast and accurate into an existing framework. The Royal Berkshire Hospital have taken the leap successfully by partnering with bioMérieux, combining traditional methods with new, dramatically reducing waiting times for test results.
Where the value is in that diagnostic certainty. These decisions can be life or death decisions, so making sure that a patient is on appropriate antibiotics when they are overwhelmed with infection and on multiple organ support, on mechanical ventilators and sometimes dialysis is absolutely key, and it's absolutely key that we have them on the right antibiotics at the right doses to enact a clinical cure of their infection.
Having just celebrated its 60th anniversary, bioMérieux, a family-owned company, has committed itself to supporting public health and in particular to infectious disease.
We are absolutely passionate about supporting the healthcare system to tackle antimicrobial resistance, as we see as one of the significant healthcare challenges that we face in our age.
And could you explain why this has become a problem?
We're seeing that routine healthcare procedures are being challenged. Things that shouldn't be causing health problems are now causing health problems because bacteria are getting resistant to antibiotics. We've got to protect the antibiotics that work.
Using one assay that can identify the full range of organisms that can cause a clinical syndrome is cost effective. The quicker the patient is started on the right treatment, they get better quickly. And if they get better quickly, they get discharged from the hospital quickly. That
certainty also has a benefit for the wider healthcare community, because when we have that diagnostic certainty, it often gives us the confidence to send patients home earlier from the front door, from the emergency department or our acute medical unit, with better flow for patients, potential cost savings for the NHS as a whole or the healthcare system as a whole.
I think we've all had, friends or family who have had an infection. There's been recent examples of MPs and celebrities who have developed sepsis. And all of those could have been prevented with the right diagnostic at the right time, with then led to the right treatment. And I think that's absolutely critical. We should remember that. That's why we're here as an organisation.